In 1955, the Department of Health defined deafblind as followed. A person is regarded as deafblind if their combined sight and hearing impairment causes difficulties with communication, access to information, and mobility. This includes people with progressive sight and hearing loss. In other words, deafblind means an individual has impairment in both hearing and vision. When a person has two sensory impairments, it is called dual sensory impairment or multisensory impairment. Most individuals who are deafblind do have some hearing or sight. Being deafblind is not about the amount of hearing and sight an individual has, rather the combined impact of having more than one sensory impairment. The majority of individuals who are deafblind also have additional disabilities. A few examples of these additional disabilities are cerebral palsy, Down syndrome, trisomy 13, and Usher syndrome. There are two types of deafblindness. The first one we will discuss is congenital. Congenital is defined as present from birth. When an individual has congenital deafblindness, they are born with sight and hearing impairments. The second type of deafblindness is acquired deafblindness. This is when an individual acquires or experiences sight and hearing loss later in their life. This can occur at any time for various reasons. Here I have listed some potential causes of both congenital and acquired deafblindness. Congenital deafblindness can occur from complications during pregnancy or at birth. It can also be caused by a wide variety of syndromes, some of which include Down syndrome and maternal rubella. This can also happen if a baby is born prematurely. An individual may become deafblind later in their life due to an illness such as meningitis, accidents or trauma like asphyxiation or stroke, and it can also simply happen during the aging process. Those who are deafblind can communicate in a variety of ways. The way in which an individual will communicate will depend on the severity and degree of their disability. Sign language is one way those who are deafblind can communicate. They can also communicate by adapted signs. These are signs based on sign language, usually American or British, but made simpler. Oftentimes, this is used to teach children with autism spectrum disorder. Tactile sign language is common among deafblind individuals. This is done by the deafblind person putting their hands over a signer's hand to feel the hand shape, movement, and location of the signs. Speech reading is used by those who have little to no vision. The deafblind person will put their thumb on the speaker's chin and their fingers on the speaker's cheek to feel the vibrations of the person's voice and the movement of their lips. TTY with Braille can also be used. This allows deafblind individuals to use the telephone. The device can also be used as face-to-face communication to communicate with someone who does not know any other way of communicating with a deafblind person. Due to the varying definitions of deaf and blind, it is hard to estimate an exact number of individuals who are considered deafblind. However, Gallaudet University estimates that there are roughly 10,000 children in the U.S. who are deafblind and between 45 and 50,000 adults who are deafblind. As mentioned before, many deafblind individuals have other impairments as well. It is estimated that about 90% of deafblind children have at least one additional disability or health issue. These additional disabilities can be physical or cognitive. Individuals could also require excessive healthcare needs, or they could have behavioral problems.